afternoon, everyone. I'm Kathy O'Regan, PD&R's Assistant Secretary, and I want to welcome those of you in the audience still coming in here at headquarters and those joining us via the webcast today for our quarterly briefing. As usual, the end portion of this event includes a question and answer session, so I just want to prompt you now and encourage those of you viewing the live webcast to follow along on Twitter and tweet your questions using hashtag PDRUpdate, or email your questions to pdrquarterlyupdate@hud.gov. I'm going to repeat that a couple of times during the event, and if you're watching online, we've got this on the webcast site. Okay. I'm really happy to see a good crowd here today, and I know that we've had over 300 RSVPs for the webcast. We're going to follow the similar format that we've used in the past. We're going to start with Kevin Kane, PD&R's Chief Market Analyst, who's been updating us since 2010 on the state of U.S. housing markets. And today he's going to share the news for the second quarter of 2014. And then we're going to move to our panel discussion on the effects of housing and neighborhood on children. This topic is really at the core of most of our work, which we were just talking about here as we were discussing this and a bit over lunch. Housing as a platform, which emphasizes the connection between quality, affordable housing and important health, educational, economic outcomes, has been a key strategic direction for HUD since 2009. It's really the same formation that Secretary Castro was using on thinking of housing as providing opportunity. It's what it does in other aspects of lives that bring us to this work. And in our work, our partnerships with other agencies, and in participation with the How Housing Matters initiative, we've considered how housing quality and stability impacts a variety of populations, not just children, but today we're going to be focusing on children's outcome. In terms of children, there's considerable evidence that a wide range of outcomes are closely aligned with housing and neighborhood quality, among them physical health, behavioral and emotional welfare, school achievement, and economic opportunity, which is really what our panelists are going to be talking about during their part of the discussion. We've got three terrific discussants here for the panel. In addition, I'm pleased to confirm that Secretary Castro will be joining us to make his own remarks on this topic after the panelists have made their finished remarks. Although ETA is exactly that. I'm warning you now, it's the estimated time of arrival. There'll be a little bit of stretching and morphing as that evolves. But we've got a flexible crowd and panelists on that, so I'm actually just going to move on to the next part of the presentation and turn things over to Kevin. Thanks.
Thank you, Dr. O'Regan. I had a couple good secretary jokes that I was going to use, but I guess I have to hold off on those until the next time. Before I begin, as always, I'd like to thank Randall Goodnight, Wendy Ip, Ben Hoke, Elaine Ng, and Holly Woods Weaver, who helped put together all the maps that you'll see in my presentation this afternoon. Just a note about the maps, the color themes of the maps are all the same, where brown indicates worse off conditions or declines in a variable, and blue indicates better conditions or increases. First, we'll discuss the nation's economy, then we'll look at the nation's sales and rental markets. All right, so this first figure shows the year-over-year percentage change in non-farm payrolls since 2004, looking at both the 12-month and 3-month averages through June of 2014. Non-farm payrolls are a measure of the number of jobs in the economy. The 12-month average, which is shown in blue, and the 3-month average is shown in red. During the 12 months ending June 2014, non-farm payrolls averaged 137.5 million jobs. This was up by 1.7% or 2.4 million jobs compared with a year ago. The 3-month average was up by 1.8% from a year ago. The rates for both of these series have been relatively stable since June of 2012, and you can see that with the very flattening of the curve on the right. For the 13th consecutive quarter, every region in the country added jobs relative to a year ago, and you can see the entire country is shown in blue. 5 regions in the darker shade of blue grew at a faster rate than the national average, and this was led by the Rocky Mountains and the Southwest, which both increased by 2.6%. For the 7th consecutive quarter, growth was slowest in the Mid-Atlantic region at 0.8%. And relative to a year ago, the rates of growth were up or the same in 7 regions, and they were lower in 3 regions. On a state level, 5 states had rates of growth that were above 3%, and that was led by North Dakota at 4.8%. And this was a result of a 20% increase in the mining and logging sector. Looking at this map, we see the strongest regions of growth are in the South and in the West. And in light of our panel discussion this afternoon on the effects of neighborhoods on housing on children, my team put together this next map. And this shows the percentage of children who are living in poverty based on ACS data. The national rate was 22.5%. The light brown areas show areas that were up to 5% above the national rate, and the dark brown areas are more than 5% above the national rate. The blue colors represent those areas that are below the national rate. Now, clearly you can see that even though child poverty is widespread, it's disproportionately higher in the South and in the West. So despite those areas leading the nation in job gains, the benefits of those job gains are not necessarily reaching everyone. Let's take a closer look at non-farm payrolls in the Mid-Atlantic region by metropolitan area. Year-over-year growth in this region during the second quarter was 0.8%, and out of the 36 metropolitan areas in the region, 25 added jobs, led by Wilmington at 2.7%, and 3 others also grew faster than the national average, those all shown in dark blue. 21 other areas grew at a slower rate than the national average, those shown in lighter blue, and notable metro growth in the region included Baltimore at 1.8%, Pittsburgh and Philly were both up by less than 1%, and the 11 areas in brown had a decline, with 9 of those areas declining by less than 1%. The national unemployment rate was 6.1% during the second quarter. This was down from 7.4% a year ago. The 6 regions in blue had a rate that was less than or equal to the national rate, led by the Rocky Mountains at 4.5%. The 4 regions in brown had a rate that was higher than the national average, led by the Pacific at 7.1%. And on a state level, rates ranged from a low of 2.7% in North Dakota to a high of 7.9% in Mississippi. On a national level, the unemployment rate during the second quarter was down 1.3 percentage points from last year. The unemployment rate declined in every region of the country, again, the whole country in blue. Those in darker blue declined faster than the national average, led by the Pacific, which was down by 1.6%. The unemployment rate declined in every state of the nation except for Alabama, which was only up by less than 0.5%. Now let me give an overview of current housing market conditions. Sales market conditions remain balanced throughout most of the country. Just as a bit of background, balanced conditions exist when the quantity of housing supplied equals the quantity demanded. Soft markets occur when the quantity of housing supplied exceeds the quantity demanded and we have a surplus. And tight markets occur when demand exceeds supply and we have a shortage. All 3 home price indices show that home sales prices continued to increase in the second quarter. However, the rates of growth declined for all 3 indices. Home sales increased by 2.2% during the 12 months ending in June 2014, this according to CoreLogic data, and this is a slowdown from 6.1% last quarter. Inventories of new homes for sale were up by 23% from a year ago, and they were up by 6% for existing homes. Based on the current rate of home sales, there's a 5.8-month supply of new homes. This compares with a 4.2-month supply a year ago, and there's a 5.5-month supply of existing homes compared with a 5-month supply a year ago. The sales vacancy rate was 1.9% in the second quarter. This was unchanged from a year ago. Rental market conditions continue to tighten throughout much of the country. Absorption of new apartments remained relatively unchanged at 64%. Multifamily production increased by 11% during the second quarter of 2014 relative to a year ago. And let's take a look now at regional conditions. These are assessments provided by our field economists. Relative to last quarter, improvements in an area are shaded in blue, and declines in conditions are shaded in brown. Sales market conditions, again, remain relatively balanced in most of the country. Conditions improved a little in the Mid-Atlantic and the Pacific to become more balanced after experiencing some slightly soft markets last quarter. And in the Rocky Mountains, things remain slightly tight. Rental market conditions are also showing signs of tightening, particularly in the Midwest, Great Plains, and Rocky Mountain regions. Conditions improved slightly in the Southeast and in the Pacific, where conditions became more balanced. This next figure shows the year-over-year change in home price indices on a monthly basis. All three indices have shown year-over-year price changes since early to mid-2012. In June of 2014, the S&P index, which is shown in blue, was up by 6.3% relative to a year ago. The FHFA index, which is shown in red, was up by 5.2%, and the CoreLogic index in black was up by 7.2%. The rates of increase have been slowing since the end of 2013, when both S&P and CoreLogic had double-digit increases. This next map shows the change in the CoreLogic average home sales price during the 12 months ending June 2014 compared with a year ago. Nationally, the average increase was 6.9%, with prices up in every single region, again, all in blue. The four regions in the darker shade of blue increased faster than the national average, led by the Pacific at 14.3%. Prices were up in 47 states, and 4 states had double-digit increases, including Michigan, California, Nevada, and Florida. According to the Census Bureau, the median price of a new home in the second quarter was $277,200, up 3% from a year ago. And according to the National Association of Realtors, the median price of an existing home was $212,267. This was up 5% from a year ago. The Southeast region had the second largest price gain in the country, up by 8.1%. And part of this was due to the increase in new home sales, which were up 15% in the region, and this was the largest increase in new home sales in the country. This map shows 91 metropolitan areas, and prices were up or unchanged in 71 of those areas, shown in blue. And they were down in 20 areas, shown in brown. All of the declines were in smaller metropolitan areas. 26 areas increased at a faster rate than the national average, and those shown in the two darker shades of blue. Increases in the larger metropolitan areas included Fort Lauderdale, up 15%, Atlanta, up 11%, Nashville at 10%, Miami at 9%, and Tampa and Jacksonville up by 8%. This next map shows the percent of home loans that are 90 or more days delinquent, in foreclosure, or in REO as of June of 2014. REO stands for real estate owned, which means that the lender now owns the property. The national average was 4.9% of all loans in those three categories. This was down from 6.3% in June of 2013, and also down from the recent high of 9.2% that occurred in February of 2010. The 4 regions in brown have a rate that's higher than the national average, while the 6 regions in blue are below the national average. For the 4th consecutive quarter, the rate declined in every region of the country, and also declined in every single state, with the most dramatic decline in the Southeast, which was down by 2.4 percentage points, led by a 4.6 percentage point decline in Florida, where the rate is still the second highest in the country at 9.3%, slightly lower than the 9.7% rate in Nevada, which also had a decline of 2 percentage points from a year ago. Let's take a closer look at the percentage of distressed loans by metropolitan area in the Rocky Mountain region, which has the lowest rate of distressed loans in the country at 2.3%. This region has had the lowest rate in the country since the first quarter of 2012. This map shows the rates for each of the 22 metropolitan areas in the region, and all of the metros are in blue, meaning that every area is below the national average. The darker blue indicates areas 2 percentage points or more below the national average, and that includes 18 of the 22 areas. Denver was at a rate of 2% and Salt Lake City at 3.3%. Existing home sales were up by 2.2% during the 12 months ending June 2014. Sales increased in every region of the country except for the Pacific, which was down by 8%. All the rest of the regions are shown in blue. The 7 regions in dark blue increased at a faster rate than the national average. Relative to last quarter, the 12 months ending March, the rates of growth were down in every region except for the Great Plains, which was relatively unchanged. The largest increase occurred in the Northwest and in the New York, New Jersey regions at 6.7%. And just to note, not shown on the map, new home sales were down by 6.4% according to the Census Bureau, and existing home sales were down 4.5% according to the National Association of Realtors. Let's take a closer look at the New York, New Jersey region, which had the highest increase in the country at 6.7%. 6 of the 20 metro areas actually had declines in sales, and those are shown in light brown. And although these are smaller areas, the declines were significant, ranging from 2% to 10%. So the question, why the overall increase in the region? Well, one significant factor was the increase in REO sales. Recall that this region has the highest rate of distressed loans in the country. And during the second quarter, the number of REO sales was up by 20% in the region. This was the largest increase in REO sales in the country. So this is good news, and hopefully they'll continue to work through the distressed inventory. Let's take a look at building activity. Single-family home building, as measured by building permits issued, remained relatively unchanged at 164,000 homes during the second quarter. This was up 1% relative to a year ago. New York, New Jersey led the gains with a 6% increase, followed by 4% in the Southwest and Pacific. And these were offset by declines of 8% in the Mid-Atlantic and 6% in the Northwest. The number of multifamily units permitted was up by 11% to 99,950 during the second quarter. Increases occurred in 6 regions and ranged from 1% in the Pacific to 69% in the Northwest. Gains of more than 40% occurred in the Midwest and in the Southwest. Declines in the other 4 regions ranged from 3% in New York, New Jersey to 20% in the Southeast. Vacancy rates continue to decline throughout much of the country, the 3 shades of brown dots, and the rate of decline continues to slow. According to Reese, which covers 275 market areas, vacancy rates were down in 183 areas, those in the 3 shades of brown. They were up in 78 market areas, shown in blue, and unchanged in 14 areas, also in blue. Trends are all relatively unchanged from last quarter. The average U.S. vacancy rate declined by 0.2 percentage points from 4.3% last year to 4.1% in the second quarter 2014. There were 10 markets with a decline of 2 percentage points or more, those shown in the darkest brown. Light brown areas declined by less than 1%, and the medium brown areas declined between 1 and 2%. And there were 4 areas in the country with an increase of more than 2 percentage points. According to the Census Bureau for the entire U.S., the rental vacancy rate was 7.5%. This was down from 8.2% a year ago. Let's take a closer look at the Great Plains region, where market conditions ranged from slightly tight to tight. Vacancy rates were down in 11 of the 14 areas shown in brown, all by less than 1%, and they were up in the other 3 areas by less than 1%. And just in case you have any plans to move to Ames, Iowa anytime soon, you need to budget a little extra time now to find an apartment. The vacancy rate there is less than 1%. Because of those tight conditions in Ames, rents were up by 3.6% in most of the region. So what about rents in the rest of the country? Rents were up by 3.2% nationally, according to Reese, from the second quarter 2013 to the second quarter 2014. The average market rent in the second quarter for the 275 areas was $1,147. Rents increased in 260 of the 275 areas. Again, those all shown in blue. They were down in 10 areas and unchanged in only 5 areas, those areas all shown in brown. Areas in light blue increased by less than the national average, and the 40 areas in dark blue increased by more than the national average. And you can see that 15 of those higher increasing areas were in the Southeast region. Let's take a closer look at the Northwest region, where rental market conditions have been tight for the last 2 quarters. Rents in the second quarter were up in all 15 of the metropolitan areas, all shown in blue, led by a 6.5% increase in Seattle, a 4.1% increase in Bend, and a 3.6% increase in Portland. Those all shown in dark blue because they were up by more than the national average. So in summary, year-over-year job growth for the second quarter was up by 1.8%. Sales markets remain balanced throughout the country, but the rates of gain slowed for both home sales and for prices. Rental market conditions continue to tighten throughout the country, with rents continuing to rise and vacancy rates continuing to decline. For additional information, you can please contact your local field economist or regional economist. You can look at the U.S. Housing Market Conditions website, or you can feel free to contact me. So thank you very much. At this point, I will hand things back over to Dr. O'Regan.
Thank you, Kevin. I was busy taking notes. I should always get copies of your slides. So what I want to do now is introduce the panel. We've got three esteemed panelists, Sandy Newman, Lauren Smith, and Jean-Claude Brizard. I'm going to give just quick highlights of their bios and do a slight frame for the way we're going to go through the discussion today. So Sandy Newman is going to start us off, and she's a professor of policy studies at Johns Hopkins University, where she directs both the Center on Housing, Neighborhoods and Communities, and the International Fellows in Urban Studies program at the Hopkins Institute for Health and Social Policy. Mouthful. Probably an important piece of frame for thinking about Sandy's work is she's interdisciplinary in her background and research. She holds joint appointments with the Department of Sociology and Health Policy and Management. Her research focuses on the effects of housing and neighborhoods on children and families and on the dynamics of neighborhood change. So we've asked Sandy to start off the panel by doing a frame of the connections between housing, neighborhoods, and children's outcomes. And then she's going to also touch on some of her current research on the effects of housing affordability on outcomes for kids. Then we'll move to Lauren, who is an MD and the Senior Strategic Advisor at the National Institute for Child Health Quality in Boston, where she leads a national initiative to reduce infant mortality. Her research career has focused on child health disparities and the implications of social policies, such as housing policy, for child health and well-being. Lauren has experience in federal and state government, including as a policy analyst for the U.S. Department of Health and Human Services and as a W.T. Grant Health Policy Fellow at the Office of the Massachusetts Speaker of the House, so she also brings that policy perspective to her work. Lauren is going to discuss the effects of housing quality and neighborhoods on children's outcome. Then we'll move to Jean-Claude, who is the president of Upspring Education Group, a network of highly experienced education practitioners and not-for-profit leaders who support the strategic, instructional, and operational work of school superintendents, public charter leaders, and education organizations across the U.S. and abroad. And Jean-Claude is probably perfectly situated to do that, given his decades of experience leading change and improvement at the school level and at school system level. He's been the chief executive of Chicago Public Schools, superintendent of schools for the Rochester, New York School District, and has spent 21 years as an educator and administrator with the New York City Department of Education. So he's kind of been embedded in some of the more interesting school systems for dealing with this. And Jean-Claude will speak about the relationship between housing and neighborhoods on education outcomes. So with that, I'm going to hand it over to Sandy, who's up first. And now we'll move to the true panel format. You can sit from there. Do whatever you like.
What do people want? Podium or sitting? Say sitting. Let's see how it goes. We can change in the middle. So thanks, Kathy, very much. Kathy and I go way back, so I'm going to call her Kathy, not Dr. O'Regan, if that's okay. Okay, great. So as Kathy said, one of my charges today is to frame the discussion, and we're dealing with multi-dimensional concepts here. So let me begin with sort of the umbrella over housing and neighborhood. And for many of you in the audience, you're very familiar with the urban economist's view of the housing bundle. And for the urban economist, the housing bundle includes both housing and neighborhoods. So let me just walk you through what that conceptualization is. The notion here is that all of the features of the house and the neighborhood and the community are capitalized into the price or the rent that the resident is going to pay for that property. So it all comes under that particular rubric. So we start with the physical dwelling and all of its features, then the affordability, Then the fit between the household and the housing unit. So we typically think about that in terms of crowding, but there are other ways to think about fit. Features of the neighborhood, schools, crime, stores, all sorts of amenities and disamenities in the neighborhood. The neighbors in the neighborhood, and this includes both their demographics as well as their behavior. There's been some work on that topic. Land use regulations, what restrictions exist in your neighborhood and what kinds of effects do those have on who lives there and the kinds of properties. Property taxes, which the owner pays directly and which we assume are passed along to the renter. And although the urban economics theory does not really include housing stability under this umbrella, housing stability has become a very important issue, and so it's important to include it on this slide. Then moving over to child well-being, which is the outcome part of our discussion today. And as I say here, like the housing bundle, this is also multidimensional, multifaceted. So we begin with the health of the child, physical, emotional, mental, education, cognitive performance, the family environment the child is living in, the social environment, the economic circumstances, and the physical environment. And Dr. Smith will be addressing, as Kathy said, the health component. Mr. Brizard will be talking about education, and as it turns out, in a few minutes, I will talk about cognitive performance from a particular perspective. So bear with me on this slide. I thought it was important to talk a little bit of how we conceptualize how housing in neighborhoods might actually affect child well-being. And this is a simplification, so for the researchers in the audience, you can argue with me later. But there are really three basic types of relationships. The first is what we call a direct effect. And the best example from the empirical research that we really have a lot of at this point is the direct effect of lead paint on the cognitive performance of the child. Lead has a biological effect on the brain of the child, and it results in cognitive deficits. The second is indirect effects, and this is an effect that is mediated by some other feature. So let's just use housing affordability or unaffordability as the example. We can imagine, and this is our hypothesis, it's theoretical, that living in a house that really takes up a lot of your discretionary income would create stress for the parent. The parent then perhaps relieves that stress in being a less high-quality parent than they might be a punitive parent. And as a result of that, there may be effects on the cognitive performance of the child. So it's not directly related to affordability, but it's indirectly related because of the effects of affordability on the child's family circumstances. And then the third is an interaction effect. And here we talk about an effect that depends on some other feature. And people at HUD, particularly in PD&R, should be very familiar with this particular example, which comes from the MTO experiment and research, in which the researchers found that the effects of neighborhood poverty on mental health outcomes for children and youth really depended on the gender of the child. So there were big impacts on girls and adolescent girls, but there were no such impacts on boys. A big caveat at the bottom here that I feel very strongly about. These are simple relationships that I've put up. There is nothing about this enterprise that we're talking about that is simple. Specifying the multiple links that almost assuredly exist among and between all of these features needs to be thought about very carefully, and it is really quite a challenging area for the researcher. Just to set the context today with some statistics, again, a caveat here. I pulled these out of the 2005 American Housing Survey, so this is pre-Great Recession. I have taken a peek at the 2011. I know the 2013 is out. I haven't looked at it yet. I don't see much difference in the 2011, so I think these are fine statistics. So if you just scan these statistics, you'll notice that The one that stands out is housing unaffordability. This has really become the modal problem for families with children, and you can see that more than 4/5 of poor children are living in housing that's considered unaffordable. More than half of what we call near poor children are. In terms of neighborhood context, here the statistics are more modest. The one that is the modal group here, which I don't think people realize, is noise in the neighborhood. After that, crime, and schools is lower than I think some people might expect. But I will say that the school problem is more likely to be reported by poor families, and that particular one has gotten worse over time. So to summarize, there's been dramatic decreases in physical inadequacy, about 50% or more since the 1970s, and by contrast, dramatic increases in unaffordability, with severe unaffordability twice as likely for poor families with kids than in the 1970s, and mostly modest improvements or stability in the neighborhood features, again with the exception of poor children, both with respect to crime and with respect to schools. So now I want to turn to some research that my colleague Scott Halupka and I have done in the last few years, focusing on this very prominent, prevalent problem of housing affordability, and begin by posing the question, how might housing affordability actually convey effects onto cognitive performance of children? What I call the conventional view is that unaffordability reduces the discretionary income that's available to families, and therefore it forces them to cut back on other expenditures, including necessities and enrichment expenditures for their kids. At the other end of the continuum, what I'm calling the less conventional view, because it's getting very little attention, is that if a lower income family is actually spending too little of their meager, admittedly, income on housing, they are likely to end up in a very low-quality unit in an undesirable neighborhood. So that may also be a problem. We should not always think about lower housing cost burdens as positive. And so here I say in the third point, if both the conventional and the unconventional views are correct, that is that when you're spending too much, it's bad. When you're spending too little, it's bad. What we would expect is an inverted U-shaped relationship between cognitive performance on the y-axis and housing cost burden, that is the share of income going to housing, on the x-axis. And we're thinking that 30% of your income for housing has been the rule of thumb for both the government and the private sector for a very long time. So the expectation, if that's correct, is that you'll see an inflection point at 30%. With lower performance at both the lower end and the higher end. So what did we find? Well, we began with research using the panel study of income dynamics and its child development supplement, following children since birth and looking at their cognitive outcomes in 2002, controlling for a wide variety of features of the house and the area they lived in, and doing what we could statistically to try to simulate experimental conditions. And what we found in that paper was that, in fact, spending 30% of income on housing was associated with the best cognitive performance of children. And so the question then became, well, what is the mechanism here? There's no reason why greater discretionary income should have an impact on children if that money is not then directed toward investment in kids. So we bit the bullet as it is, and we turn to the Consumer Expenditure Survey. This is the survey that is used to set the Consumer Price Index. It has hundreds and hundreds of expenditure items, and households selected for the survey respond and say exactly how much they've spent on each of these. And in using 5 years of the CE survey, we found that, in fact, spending 30% of income led to greater spending on child enrichment, and therefore this is a potential mechanism for why we're seeing better cognitive performance at the 30% level. So what are the implications for housing policy? Well, first of all, search as I might, I could not find any validation for the 30% housing cost burden figure that has been used as a rule of thumb for a very long time. So this is, if you wish, a little bit of validation from the empirical evidence about the 30% rule. Second, this is sort of, I don't know how important this is to people in the room, but HUD does define severe unaffordability as 51% of income or more. From the perspective of child cognitive performance, we actually saw the huge decline happen at about 60% and more. And then we think an important takeaway is that there should be greater attention to those who are spending too little on housing. What's the status of our understanding based on this and based on other evidence? So, I mean, this is certainly very suggestive and intriguing and interesting, but I pose to you the question of what about the possibility that the parents who are spending about 30% of their income on housing differ from those who are spending less or those who are spending more, and it's those differences that actually result in the cognitive performance differences in children. When you're using survey data, you can control for everything that's in the survey, but you can't control for everything. So there may be important omitted measures, and the problem that we face is that we cannot really draw strong causal inferences from such non-experimental research because of this selection factor. In addition, we have been very much hampered by the lack of housing data in rich longitudinal surveys, such as the Panel Study of Income Dynamics and the National Longitudinal Survey of Youth, both of which are outstanding surveys. The lack of child and family data in the wonderful American Housing Survey, and I might also add the AHS is longitudinal with respect to housing units, not with respect to households. We are lacking tested measures of housing from the perspective of child outcomes. We have many, many housing measures, but they've not been looked at from the perspective of child well-being. And of course, we're lacking experimental evidence. So I'm going to end today with some good news, and that is that HUD, along with other funding partners, the National Institutes of Health, the MacArthur Foundation, is supporting a new study, a new data collection that is focused on the effects of housing, neighborhoods, and schools on children's healthy development, with very rich measures on family process, family composition, family dynamics. The study includes a housing voucher experiment, and that should allow us to address the selection problem that really stymies observational studies. So I've included the links to the papers that I've used for this presentation if anyone is interested in looking at them, and thank you for your attention.
Thank you, Sandy. That's perfect. Thank you. You can go. You can. Speaker sitting, and now we'll have Lauren up at the mic.
I think better when I'm standing.
Yeah,
What it is. So thank you very much for this opportunity to speak to all of you. And I'd like to really pick up where Sandy left off, so it was a great segue into thinking about how does the social become biologic? I think everyone has heard of the concepts of social determinants of health, which is what's out there, the social conditions, the public policies. How does that get into the body? How does that end up having its health effects? And that's really, in a way, why we're even talking about housing and environment and neighborhood on the impact of that on child health. So how does it get into the bodies? Through multiple mechanisms, and if this were a longer time, we could generate some of these ideas from your experiences, but there's food deserts, there's obviously issues related to environmental toxins and exposures, advertising. I'm sure if you drive around in the neighborhoods in certain segments of Washington, D.C., there's all sorts of tobacco and alcohol billboards and advertising, and in other neighborhoods, there's none. That's not randomly distributed, and that has an impact on the neighborhood quality. And I suspect is rolled into the costs in terms of that housing bundle that you were talking about, is the exposure to these sorts of things. Healthcare access, residential segregation, transportation, educational quality, which Jean-Claude is going to be talking about, and neighborhood violence. So there's a whole host of ways in which the social becomes or generates its biologic impact, and I'm just going to talk about a few of them today. So some of you may be familiar with this pyramid from a sister agency to HUD, the CDC, which is essentially looks at what is the proportion or what is the magnitude of impact of different levels or different kinds of interactions. And at the top of the pyramid, you have counseling and education. So that's me as a clinician telling you as a patient, you really should stop smoking, it's not good for you. Important, must be done, but has a relatively small impact because everyone has to do it one at a time. It doesn't have a large population impact. As you move further down this health impact pyramid, you see what I've highlighted for you, which I think is most relevant for our conversation today, which is the changing the context in which individuals make their decisions. So if cigarettes are more expensive, if there are limitations on where you can purchase them, if there are limitations to where you can smoke them, all of those things change the context so that individuals make different patterns of decisions. So that's where I want you to be thinking about today is moving, and my work in public health is really focusing on that level, changing the context. Not that the other levels aren't important, but this is where you can have a larger population impact. So thinking about neighborhoods. So I don't think I have to convince you that there are significant disparities in fast food nation. You know, fast food restaurant density is related to both income and the proportion of minority residents in the neighborhood. Some studies have indicated that a 4% increase in the proportion of black residents is associated with a 10% increase in fast food density. And I challenge you to think about your drive around neighborhoods in Boston, I think I'm home, neighborhoods in Washington or around here where you can find a lot of fast food restaurants or none. And again, it's not randomly distributed. When you think about the flip side, what about the healthy options? We know, and this is that supermarkets are more likely to have what we term heart-healthy food, fresh fruits and vegetables, lean meat and fish, than the grocery or convenience stores or some of the small corner variety stores. However, again, low-income and minority neighborhoods are much less likely to have supermarkets, full-service supermarkets, and are much more likely to either have small grocery stores or the kind of corner stores that people don't have a prayer of being able to fulfill the education advice that I gave at the top of that pyramid, counseling and advice, and I say, oh, you have heart disease or you have diabetes or whatever, here are some recommendations for your diet. There's no way they'll be able to fulfill them if they don't have access to it in their neighborhood. So this is a fascinating study for those of you who are interested. It was really looking at the relationship between location of supermarkets and diet quality. So what they did was they geocoded supermarkets and then looked at the diet quality of the individuals that they were studying. And this was for a cardiovascular health and disease study, so that's what they were mainly focusing on. They found that there was significant racial differences, that the white participants had a much more access to healthy food, both because they had access to the supermarkets themselves, but also because they had better access to transportation to get to the supermarkets. Blacks had much less access to the healthy food because of where they lived. And again, you can think about that as related to some of those other issues that I described as how the social becomes biologic. You think about residential segregation and other amenities that Sandy talked about of the neighborhood, and supermarkets would be one of them. So the reason that this is important is not just like, well, who cares where supermarkets are, who cares where fast food restaurants are. It's because it has an impact on what happens in the community. And so what I'm showing you here is data that we collected when I was the medical director for the Department of Public Health, and it indicates, the plot you see is the proportion of children who are overweight or obese, and we do that in by assessing children, measuring their BMIs in school in Massachusetts, plotted against the median household income of the community. So what's important about this representation is that it's not an individual association of my obesity and my income. It's the association of the proportion of kids in the neighborhood with the income of that community. And no great higher order math is needed to see that there's a strong relationship between the proportion of kids who are overweight and obese and the income of the community. So that tells you it's not about the individual, it's about something about that community and their neighborhood, and that's why I bothered to show you the data around the fast food and the supermarkets. So quickly, just to think about housing, so we talked about neighborhoods, think about housing. We could talk an entire semester, an entire year, an entire dissertation on the impact of homelessness on children's health. In terms of their physical health, it's disruptive on so many levels that it's just hard to quantify. But when kids are homeless, they're disrupted and pulled out of their usual primary care settings. So the basic things that we expect kids to get in their primary care settings, they don't get. So they don't get screened for lead, they don't get screened for TB, they don't get their regular immunizations. So the whole point of primary care and anticipatory guidance, homeless kids end up missing that. They are much more likely to have untreated or poorly or inadequately treated asthma, partly related to where they're living and the housing conditions, which I'll come back to. They also experience much more respiratory and other infections that are directly related to crowding situations. And because of that increased exposure, they're more likely to have emergency department visits and hospitalizations, also related to the fact they don't have access to the regular primary care because they're separated from their usual sources of care. In terms of mental health, development, and behavioral impact, again, such a wide spectrum of potential impacts of homelessness on kids in terms of anxiety and depression, both ends of that mood disorder spectrum. Usually these kids have very few supports to be able to recover from, to buffer them from some of the experiences that they have. They have the developmental delay and behavioral disturbances. So those of you who are familiar with the work thinking about the toxic stress and adverse child experiences for kids, this is how that then gets into the body. This is how those experiences get into the body. In terms of substandard conditions, and I was very interested in what you were talking about, spending too less and too little money on rent or housing and what that exposes you to. And I mean, I think that we can imagine what that exposes you to, the conditions of infestations, poor physical plant in terms of water leaks, mold. That's a huge, huge predictor of asthma for kids. There's neighborhoods in Boston where the rates of asthma are just truly astronomical related to the quality of the housing there. And exposures to all of these things end up having a substantial impact on the health through asthma, as I mentioned, lead poisoning, you heard Sandy mention, injuries. Oh gosh, every year in Boston there are a number of kids who fall out of windows because there's not window guards and things that sort of other housing situations would sort of take for granted. And we also have a fair number of deaths tragically related to residential house fires, also related to both housing quality and some of the trade-offs that you were talking about. When you don't have money for heat, you use alternative heating sources, many of which can lead to increased fire danger. So this, I had to put it in here because this, well, because I'm at HUD, right? And Section 8 and housing subsidies are what you all do. And this sort of would fall in the category of what Sandy was talking about, the conventional wisdom. So this represents work that my colleague at Boston Medical Center did looking at assessing children who were eligible for housing subsidies but didn't receive them because they were on the unfortunately very long waiting list to obtain them, and found that they were 8 times more likely to suffer stunted growth from malnutrition and 50% more likely to have iron deficiency anemia. Okay, so let's go back. 8 times more likely to have stunted growth. So when you have growth stunting, that means you're short for age as well as small for age. So here's an example of housing policy literally having an impact on children's bodies. Not theoretical, not intellectual, literal. So this is an example of how policy gets into the body. And so why does that happen? Well, it happens for a whole host of reasons, but much of it is related to this budget trade-off. So this, if I'm spending, huge, and especially in Boston, where the study was done, if I'm spending, a tremendous amount on rent, I do have less discretionary income, and I do have less ability to buffer those influences for my kids. I wanted to just take a second to talk about food insecurity, because food insecurity and the associated infection malnutrition cycle is another one of the ways in which housing costs, in this case, that results in food insecurity has an impact on child health and well-being. So many of you, I'm sure, know that when you're malnourished, you have poor nutritional status, you have decreased immune function, that sets you up to having increased likelihood of having infection and illness. I think any of you who have kids know that when they're sick, they're less likely to eat. But usually, fortunately, those of us who are more well off can buffer that by when the kid is well again, will have enough extra calories in the household for them to make up what growth they lost or what weight they actually lost. In food insecure households, they don't have that ability to buffer that. So then you set up this cycle where you have more weight loss, more poor growth, worse immune function, and then you can see how you're going to cycle through that infection malnutrition cycle. And the thing that I want to call your attention to is this happens in the United States. This is not some rare kind of tropical something that happens only in rural villages in underdeveloped countries. This happens here, and I bet you could go out right now somewhere in Anacostia and find a whole bunch of kids who are suffering from this. So if you look at neighborhood housing and the impact on child health, we talked about exposures, affordability, the housing conditions. In all of those, there are pathways, and I think Sandra introduced it as sort of the direct impact versus the indirect impact. But you can create and understand those pathways between health and well-being for kids. So I'm going to stop there. Do I still have time?
If you have another slide you want to do, go ahead.
Well, why? I was trying to be good, but
You're being very good.
Do you want me to show my? I don't want to take your thing, but I wanted to just see if I.
Yes.
I wanted to bring this up. I snuck it in there, and he said I could show it. So. John Claus. Well, I thought, we decided that it would be a good segue into what he was showing.
You should always have your panelists have lunch together first, because then they figure out all the interconnections on their own.
Homelessness and housing instability, which are directly related to housing costs, especially as we heard from the first presentation, we're in a situation where many rental markets where most low-income families are living, or they're renting, not owning, they are experiencing increased rents, decrease affordability, decrease accessibility in terms of the proportion that is available. So in that setting, they are much more likely to have to tolerate poor housing conditions and or have more frequent moves because of it. So in those settings, kids who are homeless or who suffer housing instability are more likely to have numerous moves, and I think Jean-Claude is going to sort of talk about how that's disruptive of their educational experience. They're obviously more likely to miss school, because when you move oftentimes school districts, and then it takes time to be able to get you set up with what the new school is. Clearly, you can see that that's disruptive and would result in poor academic performance and the requirement for kids to repeat a grade or to have special education, which, as many of you will imagine, is not revenue neutral to the environments where these kids are going. But if you look at the graph shows the percent of homeless kids who miss 1 week of school or more than 3 weeks of school. So in this particular study, 45%, or almost half of kids, missed a week of school, and a fifth of kids, 20%, missed 3 weeks of school. So there's no way you can stay up and pass all of those high-stake tests that many school districts have now if you're missing 3 weeks of class. So that's an important implication. And then this just shows, it's relatively old data from our Mass Department of Education, but the proportions remain the same, of looking at the cost per year per pupil of the educational failure. So all of those kids who had to repeat a grade and stay back or have special ed costs quite a lot. And you could think about how much the rent, the difference between that the families need to actually stabilize them in their housing, how that would compare to that. So,
That's great. Thank you.
So I like symmetry. I was going to sit so we have one person up, one person down, but I'm going to be asymmetrical. So if you think about the last two presentations, I'll try to build a lot on what's been said. The one thing that will not be in one of my slides is the idea or the issue of disproportionality, the overrepresentations of black boys, Latino boys, poor people in special education, in suspension, in expulsion. If you draw the line, you'll see pretty good correlation between the two. But let me go back and talk first about some of the current rhetoric in education in our country. There's this argument going on right now between, I guess, the left and the right, or whatever side, whatever you want to call them. Those who are saying that if you fix poverty, you fix schools. And those who are pushing, you fix schools first, and you'll fix poverty. Of course, we all know you got to do both at the exact same time. So my hope is to show very concretely how the two are sort of connected and how housing plays a big part in the work that we have to do. One thing we do know is that all kids, regardless of income, regardless of ethnicity, will learn in a great school. The question is, how do you create a great school? What I'm going to push, frankly, is not just the academic work that's done in schools, it's the non-academic work that has to be done as well. I'm also going to push that it takes a city for that to happen. A school district by itself can't do this work. And often they're the ones who think they have to do it all by themselves. Teachers are overwhelmed, principals are overwhelmed, and of course everyone's trying to figure it out how to make it happen. One of my schools, when I was in Rochester, New York, as school superintendent, every single child in special ed had lead poisoning. Every single one in special ed were designated as lead poisoning. So we know there are huge connections between the two. But let me go back and talk about some of the stresses that poverty brings to education and to schooling and the effects it has early on in child's development. We do know not just lead poisoning, but that the stresses, and I'm being very careful, I'm saying stresses of poverty because being poor does not equal some of these things, right? I grew up poor, but had a mom and a dad who took great care of me and make sure I had the home environment I needed to actually be successful. We do know the issues of executive function are impacted. Brain development is impacted by often by the stresses we see that come from poverty. What we have to understand are the following. The non-academic competencies that have to present in schools are critical to a child's development, to a child's learning. In fact, there are some who will argue that work, or the lack of it, is a big part of the achievement gap in our country. There are many folks who tend to refer to these non-academic developments as soft skills, non-cognitive skills. I don't know about you, I've never seen a non-cognitive skill. And this stuff is not soft whatsoever. The question for us in education is how do we make this implicit and explicit in curriculum, in pedagogy, et cetera. When you take a look at schools like the KIPP schools network across the country, who really have done a decent job of moving kids to high levels of proficiency, what they're seeing is that these young people are not persisting in college. And they're beginning to ask why. And what they're beginning to realize is the other stuff that has to be done as well is as critical as the academic preparation of young people. So let's talk about, go back to executive function, to the work of attachment, et cetera, to persistence in higher education. When you look at mobility, when you look at stability, one of the things that often is impacted is the attachment that young people have to teachers, to adults, and to school. The sense of belonging that they have to have in a particular environment. So you think about a child who spends the better part of say 7-8 years in one school, the connection between adults and students is powerful. When small schools were being pushed in this country in earnest a few years ago, it was all about personalized environment. Now you hear technology making personalized learning more accessible. So the idea of making sure you have an adult attached to a young person creates that kind of stability that people need to do well. Children learn well when they like the teachers, when they know their teachers, and vice versa. So it's not just a child to adult attachment, it is the adult to student attachment as well that's really critical. So when you have a lot of mobility, when you have folks who are moving from home to home, who are homeless, you don't often get that kind of attachment. You don't get a sense of belonging that is so critical for a young person to learn and to be successful. And what often comes missing as well is the idea of academic resiliency. Going back to the KIPP example, going back to some of the, quote, high-performing schools who focus a lot on the academic achievement. Once they leave the environment, once the scaffold that's built within that school environment is gone, the child does not sustain, does not persist. So one thing that the folks are looking at now is how they can, yes, build a scaffold and then slowly remove it, but build resilience at the same time so this person can sustain and persist and can navigate beyond that particular school environment. There's one study that shows that a sense of belonging and attachment is the only predictor of academic resilience. So how do you make that sort of, again, accessible to the young person within the school environment by looking at how housing attaches is one thing that a lot of us are trying to figure out to make happen. So one thing that's become quite prevalent in the reform efforts, this current reform effort, is the idea of choice. The idea of opening choice to parents and students across a particular city. So I'll use DC as an example. I could use Chicago or New York for that matter. In Washington, DC, lots of policy, education policy, has made schools across the city accessible to most parents. Right? The lotteries, the out-of-boundary lotteries, et cetera. You find people making choices within charters and within the school district. An IFF study that was done in 2012 showed very clearly that while that choice is being accessed by some, it is not being accessed by many. Right? In DCPS, 74% of students go to their neighborhood school, despite this availability of choice. In the charters, it's 57%, and you can understand why. Those who are accessing the lotteries and charters are making a decision about access. They are the kinds of folks who will make those kinds of education decisions, who think to look beyond what's available around the corner. If you go east of the river, you're going to find that nearly all students go to their neighborhood school, and there are few if none Tier 1 schools east of the Castro River. So the fact is, zip code still determines what school you're going to go to. So for many people, the neighborhood school is the school of choice. So how do you make that work? How do you bring folks together and actually make that happen? So one experiment, before I get to the experiment, one thing we're learning around this choice program, and I did in looking at Chicago and in Rochester, New York, was that when you offer citywide choice of schools, other things have to come along. How you help people access choice, how you help people capitalize on opportunity becomes part of the conversation. So transportation is one thing we often don't think about. So if you live on the far south side of Chicago and I give you access to an amazing high school on the north side, if I don't subsidize your transportation, it is a false choice. You're not going to access that amazing school. And if you don't have sort of the inner understanding of knowing how to access that equity, you're not going to access it. So making that corner school work is important. One experiment that I was talking to the folks at HUD in Tacoma about really was for me very interesting. And Michael, who has the HUD program in Tacoma, was talking about this at a meeting we were at the roundtable at the Urban Institute last week at the Building Museum. Is trying something very different. How do you create some stability within the school environment by convincing parents to stay? And what they did was the following. They picked one school, and the school was McCarver Elementary School. They had, I believe, 179% or 175% mobility rate in that particular school. And so giving parents a voucher to go to a different neighborhood, they give them an incentive to stay in that particular school and work with the school district to also implement some reforms within the school environment. The school went IB. They give parents some subsidy to stay in the school in exchange for 5 things. And what they pushed was the parents had to participate in a 5-year experiment, a 5-year plan. That was 1. 2, they had to make sure the kids got to school on time every day and attend school. 3, they had to do something about their own development and employment, right? Their own sort of efficacy. They had to work with caseworkers to make sure there was a success plan built around the family. And of course, the last one, they had to participate in the evaluation of the model. And what is found so far is that mobility has decreased to 75%, from 179, 175%. So the academics hopefully will come along, but the fact is those parents staying and investing in that school and the school district also investing in the school hopefully will make a difference. So while a bit controversial about choice, we do know with many of these families who choose to stay in their community, that may make a difference and ultimately what's going to happen in terms of outcomes for that particular school. So as we look at choice and reforms across the country, that I think experiment bears watching, bears codifying, and bears sort of sharing with other folks, other cities across the country. The last thing I'll push, and this really comes from my experience as a practitioner, that as a school principal and teacher, I often understood or perhaps misunderstood that the problem was mine and mine alone. I didn't always have time to reach out to my larger community. Again, my bandwidth and capacity, frankly, weren't always there to reach out to people. When I got to Chicago, the new head of HUD, the Housing Authority, came to one of our meetings and pulled me aside and said, "Your kids are my kids. Can we have coffee?" And that began, frankly, our sharing, our sort of collaboration to make things happen. And over time, I developed the sense that we had what I call Frankenstein's monster in many of our cities. Lots of great parts, but the whole is incoherent. We often don't find ways to come together in a way that's deliberate to support the young people that we are trying to support. You'll find that schools do these case conferencing of students. You'll have 5 or 6 teachers, administrator, guidance counselors sit and talk about, Johnny and Jose and Jean-Claude about what is going on in their academic and behavioral piece, right? Seldom do you see that kind of case conferencing involve folks who are part of the social service infrastructure, the housing infrastructure that is impacting that particular student. If we can find ways of doing that in a way that is comprehensive and coherent, imagine what can be done, the power behind that. So my push very simply is that complex problems require comprehensive solutions. None of us can do this alone. To fix education in our country, especially in areas of concentrated poverty, we've got to come together. We have too many things that we do independently. We all have our own fiefdoms and our own silos. We don't come together well. So how we change policy, how we change structures to support that kind of integration, I think is critical. I'm doing work right now in about 3 or 4 schools in Washington, D.C., most of them failing schools. And I'll tell you, that is the cry coming from teachers and coming from principals. Help me understand what exists around me so I can leverage that. On November 7th, the mayor and a bunch of folks are coming together, the State Education Department, DCPS, coming together to talk about how these principals can access the larger community infrastructure to support their students and do what has to be done to improve student achievement. Thank you.
Thank you, Jean-Claude. I'm going to sit also for a while. I'd like to remind people in the audience who are watching us from the webcast that you can tweet your questions to hashtag PDRUpdate. Got that one right. Or you can email them for pdrquarterlyupdate@hud.gov. And as people in the audience are gathering their thoughts for questions they'd like to ask, and people online, I have one question for the panelists, and that you've started to go in this direction, and anyone could answer this. But you're thinking of the HUD audience here. You've drawn out some policy implications, but thinking specifically about housing policy and HUD programs on specific things you think we should do given what you've learned in your work. And I know that, Sandy, you've given us a piece of evidence that we can add to policy justification, which we really appreciate on the 30% affordability piece. But are there some other pieces directly related to the types of housing programs we do? Go ahead.
I'll start. And perhaps going back to the Tacoma, Washington example, I think that's one I would encourage her to actually support and study to see what the impact is. Again, yet the achievement sort of results are not in yet. But you've got an innovative leader, you've got a school board and a school superintendent who are willing to actually understand better Supporting that may actually inform the work of trying to create stable communities by looking at stable schools. Again, I'm a very big proponent of choice, and I believe in choice, and everyone should have choice. It's got much louder. But at the same time, if we can begin to take a look at those areas where people are not accessing choice, but instead invest in one particular school, provide incentives for parents to stay, while at the same time the school system has to offer what they're going to offer in terms of support and reform as well, you may find that you create much more stable environments for young people. The second thing I'll push, and we talked about this earlier, was the idea of 0 to 4, nurse-family partnership, ways of looking at young mothers or folks who are living in poverty, who are having children, how we support them from pregnancy to birth, and attach that to Head Start, attach that to what's become, the new sexy in America, pre-K education. You have a nice continuum. By the time they get to kindergarten, these young people are ready to learn, and you will find that you will close the achievement gap at a much, much faster rate.
Okay, so I'm going to interrupt for a second. I'm going to add a phrase. You said, your kids are our kids.
Yes.
Your kids are our kids first, right? So if you want the 0 to 4, we are the right partners for people who are going to and interested in pushing on that level. Is that, I'm doing a check. Okay. Go right on. Yes, go right ahead. You have time to answer.
I would say that what I was talking about at the beginning in terms of the influence of the neighborhood and thinking about not only the housing piece, which obviously is huge, but the development of the neighborhood and where, if there's a conscious sense of the neighborhood as having the factors that are going to support people in making healthier decisions versus not. Everyone knows you're not supposed to smoke, you're not supposed to eat bad food, tick, tick, tick. But if one has to walk uphill all the time to get to the healthier choice, you can predict statistically that fewer people are going to get uphill to that healthier choice. Whereas if the unhealthy choices are right there in front of you and they're cheap and they're, attractive, then you can also statistically predict that that's where you're going to get. So thinking about the community development piece and looking at food deserts and looking at access to safe places for kids to be outside. And since HUD has so much, provides so much housing sort of directly and then subsidized, thinking about what are the environments in the neighborhoods around some of those housing, and is it conducive to the kinds of community building that we know to be effective for creating those kinds of environments.
Go ahead, good.
I'm going to interrupt for a second, Sandy. We'll come back to this in a second, but I wanted to take a break for a moment to welcome the Secretary of HUD, Julian Castro, who would like to add some comments on this topic.
Good afternoon. Well, first of all, thank you very much, Kathy, for convening folks here today and for your stellar leadership at PD&R. And I want to thank all of our panelists as well. I trust that the dialogue has been one that's been stimulating and fruitful and challenged us to think about new opportunities to do great research, and just as importantly, to put that research into practice so that we make positive change happen in communities across the United States. I'm Julian Castro, the relatively new Secretary of HUD. I know that we have a lot of our employees here today in the auditorium and also watching, but we also have some folks who are joining us from the outside in the research community and some of our partners. Let me just start by thanking all of the PD&R staff that every day engage in strong partnerships and do fantastic research that over the years has been tremendously beneficial to the people that we serve. I just got back last night from a visit to the Pine Ridge Reservation in South Dakota and Turtle Mountain Reservation in North Dakota. and had the opportunity there to get a look at the living conditions of folks on both of those reservations, and to hear about the fact that on one of them, Pine Ridge, they had an unemployment rate that approaches 80%, and at Turtle Mountain, 68%. To hear the stories of the challenges for folks in terms of finding employment, and got to see 2 homes. In the first home, that was a 4-bedroom home, there were 13 people living there, including several in the basement. And in the other one, it was a 4-bedroom home, and there were 17 people living there, about 8 people in the basement of the home, with very little economic development on the reservation, about a 50-mile distance to travel to Rapid City from Pine Ridge, and probably about 30 miles to the nearest significant city from Turtle Mountain. And for me, it was a very poignant reminder of what I was most excited about in the first place when I agreed to take on this role, which was the question of how can we use housing as an effective platform to help improve opportunity in people's lives by helping ensure that young people have better access to good education, and that adults who are working age have access to job training and to jobs in general. And what's so important about this research is that we're coming to understand more and more the importance of taking a holistic approach to the work that we do. We've seen that in analysis of Montgomery County, of children who come from high poverty areas versus low poverty areas, and how well they do in school. We've learned over the years that it doesn't make sense to concentrate poverty, but makes sense to build up neighborhoods and to get folks into lower poverty areas. I'm interested as well, like I know you are, in how we can use the institutional leverage that we have to help folks make good choices in life about being healthy, about stopping smoking, about being financially literate. And this research is important because it helps us make good policy decisions in that direction. And for that reason, I wanted to come and just say a big thank you to you and to all of our panelists, and to say that here at HUD, the work that y'all are doing is not only on our radar screen, it is a priority in terms of partnering with you. And Kathy knows this. One of the first requests that I made of her was that I get to see a good deal of that research. And they are getting it to you. And I'll get better about getting back to you on my thoughts, but it is very enlightening. We are the Department of not just housing, but housing and urban development as well. And we're trying to put the urban development fully back in the HUD. And that includes being mindful of each of these issues that we've spoken about. I also believe that with the place-based approach that this administration has taken over the last several years, and the infrastructure for place-based work, that it provides a tremendous opportunity to make use of the research and to encourage local communities and incentivize local communities to adopt best practices based on that research. So again, thank you very much for your work. Thank you for your great ideas. It is making a difference out there. And I do believe that at the end of the day, when we measure how successful we have been, there's only going to be one question that we measure ourselves by ultimately. How much more opportunity did we create in the lives of the people that we serve? And that is not a two-dimensional question. It's a three-dimensional one that involves all of the different areas that are being discussed today. Thank you for your work. All right.
Thank you, Mr. Secretary. So Sandy, We're going to go back to you were just about to tell us one more thing that HUD can do. So we're primed to be thinking about how to make, as you
Just
heard.
to build off of the Secretary's last comment, you know, we know from research outside of the housing field that the cognitive abilities of people is very much connected to their economic outcomes. And so here we have found a link between affordability and better cognitive outcomes for children. Seems to me that this is a good argument for promoting affordability and promoting housing programs that provide affordability. Having said that, and Kathy won't like this, you know, we looked at other outcomes. We looked at health, we looked at behavioral problems, and we didn't see the same statistically significant connections. The research in the poverty area suggests that behavioral problems are much more connected to family issues, family process. So what that says to us is that in that indirect effects model that I showed you about, you know, affordability and stress, doesn't seem like maybe that's happening to produce the behavioral problems. Not clear yet what is going on there. But I think this is powerful evidence because we know that cognitive performance is so predictive of future economic outcomes.
I could just add one.
And as you're adding one more thing, people can begin to queue up for questions.
Oh, great.
Oof, and the audience has.
Is the idea of multi-generational transmission of health effects, cognitive effects? We talked about the experience of stress and living in unaffordable housing or poor conditions or having housing instability. And as I know that you are aware, the proportion of some families who have for multiple generations have lived in the same environment, which is not serving the parents and then not serving the children. And so I think it can be hard to tease out what is the environment when you have such a multi-generation sort of system that you're trying to intervene with.
Sharkey's made some arguments on that, on following poverty intergenerationally and thinking about the context versus it actually being carried in the family because of the environmental context. Yeah. Barbara Sard, and as you get started, as people come up with questions, please introduce yourselves.
Thank you. So, thinking about how to pose this, I felt like the panel gave lots of good evidence, actually, about the negative effects of paying too much for housing, maybe paying too little, in terms of the neighborhood effects, and also instability. But didn't really hone in very much on the neighborhood part of this discussion. So I wanted to bring us there. So the Center on Budget just issued a paper last week that looks at where kids in the 3 major assisted housing programs live. And there's a lot that's very disturbing in our report, I think, for the people in this room. In 2010, some 660,000 children lived in neighborhoods that were more than 40% poor. And these are the neighborhoods that typically, not 100%, but typically have high rates of violence, high rates of chaos, and other types of neighborhood factors that have been shown in a number of studies to have negative impacts on children's cognitive development. So I think it's a real challenge for HUD and its programs. About 250,000 of those kids have the possibility of moving because they have housing vouchers. The others are in the project-based programs that I think answers are, on the one hand, much more challenging. On the other hand, they have housing stability, which raises some interesting questions about partnerships with schools. So I'm interested in any of your comments. You know, what are the prospects really of getting schools in those kinds of neighborhoods where almost all of the kids are poor and few of their parents have much education to excel? and other ideas about really to take on this challenge of kids in extreme poverty, so much of which is connected to HUD programs.
She ended with school, so I'll let you start.
I'll start. I'll address it perhaps two different ways. One is that if you are going to offer vouchers for kids to go to different neighborhoods, perhaps in low poverty schools, we want to make sure that the staff in those schools are prepared to teach those children. Because you may have a school that's maybe quite affluent, folks who are not used to dealing with those kinds of challenges who may actually not be able to do that. So the development of the adults in those schools is important. The second, what I push around comprehensive solutions for complex problems, I think is critical. So I'm thinking about Chicago as you're talking. And in some of those communities, it's not just making sure that you provide, again, the kinds of stable housing for young people and their families. What else is coming with that to support the school? So economic opportunities for those parents. In some of those neighborhoods that you read about in the paper in Chicago, where there's violence and kids getting killed every single day, you have 90% youth unemployment, meaning under the age of 25. You've got 50, 60% adult unemployment in those places. So what else is coming in terms of the citywide support to support the school in its environment to provide that kind of stability for young people? So I'm thinking about the secretary and his background as a mayor. For me, one thing I would love to ask him is how are you sitting with mayors across this country to find ways to create those intersections for communities, for those neighborhoods, so we attack them one at a time. You do the kinds of turnaround that's not just school turnaround, but community turnaround, right? So it's got to involve multiple agencies, federal support, and all the heads have to come together and figure out how we're going to lift an entire community. It can be done. I'm sure there are exemplars across the country, but how do you, again, find that, make it happen? Last thing goes back to the Tacoma example, right? You have a school district, you have a housing department, and hopefully the mayor is also involved in that conversation to create perhaps one sort of exemplar that we can lean on and understand how to do it in other places. So it has to involve multiple agencies in one city to support that particular neighborhood.
So in terms of thinking about the challenge that the report poses to HUD for thinking about what we accomplish in our housing programs, it is, and I'm going to take this back also to one of Sandy's findings. We've got a lot of evidence that we believe that a collection of these neighborhood level factors matter, particularly for kids. I think our best evidence is on the child side. And we've got some disturbing descriptions of the neighborhoods that many of our assisted families live in that suggest that when we're achieving affordable housing, we may not also always be achieving the entire context that we aim for. And then we're in the crux of the hard part. How do you get there? And there really are two parts of that conversation that are not mutually exclusive outside of the fact that we're in a very constrained resource environment. I think that's the only reason we get these debates on housing versus neighborhood development and mobility. I think it's really all about the fight for a very small pie. Because you've got the secretary here and I think all of this conversation of saying we actually need to develop those neighborhoods that have the collection of attributes that make them reasonable environments for people to be living in, and particularly good environments for families with kids. In addition, we have mechanisms in our programs that are oriented towards choice for a variety of reasons that are outside of the areas of poverty of concentration that have to do with history in this country and racial and economic segregation that we are in particularly responsible for helping this country move beyond, right? So we hold both of those as being true. The challenge is, how can we improve both our place-based programs so they actually do this comprehensive and long-term development that works, and how do we improve our mobility programs so that things that achieve affordability also achieve those broader? That's where I think the really the hard and interesting work is, I'm kind of, here, and one of the questions we're going to pose is, so if there were 4 or 5 things that we could do that could move in those directions, those are the most important things for us to look at. And if there are 4 or 5 things we don't know yet that could help us move in those directions, we're particularly interested in the PD&R hat of hearing those things. Okay.
So I think, one of the most intriguing aspects of this puzzle is when a family elects to live in an enriched neighborhood, one with lots of amenities, they are trading that off. So they can only afford the very bottom of the housing market unit in that neighborhood. And the question really for researchers is to take a look at those different trade-offs and then sort out where you hit the sweet spot. I think that's really very important. And just, Barbara, to go back to your point, I also, I'm keeping my researcher hat on here. HUD did a very major and important experimental study called Moving to Opportunity. Its results were not what the researchers expected them to be. And the question that many have struggled with is we have a lot of non-experimental evidence on the one hand indicating that neighborhood matters a lot, and then we have this experiment that seemed to suggest that for many of the outcomes of interest, including for children, did not seem to matter. Some researchers have gone back in, digging deeper into the data, and are looking at the nature of distress in the neighborhoods that were included in the MTO sample. And a paper a few years ago looked specifically at Baltimore and Chicago neighborhoods vis-a-vis the other sites, and indicated that if you separated out Baltimore and Chicago and looked at the very most distressed neighborhoods and those that were characterized by the most serious crime and looked at the outcomes for those kids, on some of them they were better. So it's really important, I think, to not abandon the important research evidence, but to dig deeper into it to see if you can clarify or solve some of the puzzles that we see when we look across multiple studies.
I am going to add, the MTO study did show health results, but part of what it did is reset our frame that we tend to be thinking in one silo instead of the whole comprehensive. We have a question from Twitter that I'm going to switch to.
Yes, this question came in via email. The panel has mentioned food deserts and their impact on child well-being. Attracting retailers to locate supermarkets in poor communities has proven difficult. How do we deal with that issue and balance it with focusing on improving access to other neighborhoods?
A great question, and I'm sure many of you are familiar with the different projects, the food project being one. I know of work done in Philadelphia where they developed a neighborhood full-service, supermarket, grocery store in a low-income part of, I guess, West Philly, and it had tremendous impact, both economic, sort of culturally in the sense of how it knit people together, but that approach, the folks who did that made a conscious effort that they wanted to be there and that they were doing it and they were going to make it economically viable, and so they've been able to achieve success in a place where everyone said, no way are you going to be able to do it. So some of the arguments that I think some of the food retailers, we're not going to be able to hire anyone, people aren't going to want to come, it's going to, I think have been easily said in some ways because of the reluctance or sort of the disease with trying to try something new. But in many environments that I'm familiar with, they've been able to be actually very successful. And interesting, we had a housing project in Boston where it was concentrated and there was no grocery store in the entire neighborhood of Jamaica Plain. And I happened to live there, and because I had a car, I could drive to the grocery store in Brookline, which is a neighboring nice community, higher income community. But the folks in this housing project couldn't. When they built a Stop and Shop, which is a common grocery store up there, instantaneously, both popular, well-traveled, and changed the food environment for the sort of audience there, that neighborhood, tremendously. And it's been packed ever since. So I think sometimes it's easier to say, oh, no, we can't do it because they haven't been aware of or seen some of the successful models. But the food desert issue is tremendous.
If I can add, from a school's perspective, three things that I've been aware of, been a part of. One is the First Lady's push with the Healthy Schools campaign. I have to tell you, it's changed menus across districts across the country. So that in itself is showing kids a different kind of opportunity of fruits and vegetables, etc. So that's one huge thing. When I was in Chicago, we had schools that sort of vied and fought to have that apple on their scorecard. So that was a healthy school. So lots came with that. The second is work that's being done by a guy named Kimball Musk. I'm sure you know Elon Musk, who has the Tesla cars. His brother has built this thing called kitchen communities. So where they're going around schools across the country and they're building gardens. So they have these beautiful shaped things with topsoil, and the kids are cooking vegetables that normally would not see. So you can imagine kale coming.
They don't recognize.
Exactly. So that is one other effort that's going on. The third is in Chicago called Pilot Light, and Marif was part of this work. We lived there. About 25 chefs, 6 very active ones. But think of your top chefs in Chicago. These gals and guys are creating lessons, standards, units. They go into schools and they teach. And they map food deserts, they do things that relates to the curriculum, then they cook for the entire school. And they'll cook salmon miso soup, they'll do kale chips and things like that. Food these kids would not normally have seen, and they go home with the recipe. And the idea is to impact the home as well. So it's slow going, but they've already started, they're raising funds to actually make this kind of education happen to young people with the hope that once they're exposed, they're going to begin to perhaps push. And once you change, the whole idea of teaching a person how to fish versus giving someone fish, is trying to change hearts and minds and kids' sort of relationship to food, so they become better consumers in the future.
So one last thing I want to add on this is a way that I've been thinking about it more recently is community development has focused a lot on the economic development in neighborhoods with the lens of jobs. That was the starting place. And it took a while for that area to move to thinking about what you care about as jobs that the residents can get that are good for the residents and that they can get to those jobs, but that may not be things that you need to have in the neighborhood. And to think about what you need in the neighborhood so that the retail environment creates the environment that you want for the residents is a different way of thinking about it. So I think this is actually an area we're in the earlier stages of figuring out. So as you're saying, it's the start. It's the start.
I would just sort of, humbly request that as people think about that sort of community development, that the anchor store that they think of putting there is not a fast food restaurant, which is, and if you look at many of the ones that I'm familiar with, that's one of the anchors for that development is that, and there's lots of reasons why that's not the best.
Okay, there's room for the queue. Yes, thank you, Jade.
I'm Jade Craig, and I work for the Assistant Secretary's Office in FHEO. Secretary Castro mentioned HUD's emphasis on supporting mobility to low-poverty communities, but we've also talked a lot in this panel about supporting place-based development and reinvestment in neighborhoods. One of the challenges around dealing with the mobility versus stability question is that for many individuals, stability in a neighborhood with a lot of negative determinants or factors can actually be a bad thing rather than mobility to a low poverty community. And I wondered how you all thought about the issue of stability in what can be a good neighborhood or what many would argue is a bad neighborhood, and the effect of staying in a bad neighborhood rather than moving to a good one, quote unquote.
Thanks for that question, because I think there's been a vast oversimplification of the research on the effects of mobility and stability on children. I know that's provocative to put that out there, but there's different kinds of mobility, and think about the military and kids who are popped around all the time and do well. So the question is, what is the mediating factor there? And social psychologist Ann Maston has done quite a bit of work in which she has shown that parents, particularly mothers, play an important buffering role in moves, that there's a distinction between good moves and bad moves, as you're describing, and that With respect to school mobility, what the research evidence has shown is that, well, in general, not just school mobility, that children who have moved more than 3 times within a small number of years, and I'm sorry, I can't remember exactly what it is, that's the sort of threshold point at which things really get bad. So if you combine all of these things, you want to think about parenting skills, the nature of the move, as you're pointing out where you're moving to, and is this sort of the chronic moving syndrome, or is it a limited number of moves that are associated with job change of the father or the mother, that sort of thing. So it's a complex system, and to just say moving is bad, as you're pointing out, doesn't really get to the heart of the matter.
One thing I would just like to add to that is the concept of, depending on where people have been before the move, the level of exposure to what I would call sort of an intensely toxic environment, that toxicity may well have already, as I talked about, gotten into the body. That social has already gone biologic, and so that toxicity is carried with them, so that the issues around executive functioning or the issues around wariness and approach and interactions with others, and how do you respond when placed in a new situation or new environment. All of that goes with. So I think that there's a lot to be unpacked about when people go to better neighborhoods, but they carry their toxicity with them, and we expect that everything to be beautiful when all of that toxicity comes with. So.
Yeah, and the piece about the mother is interesting, right? You have that one person that keeps that stability. So the idea of attachment, I think, is quite large. So I'm thinking about school systems where the policy is, if you move your home, you move school. Places that forces parents to move in the middle of a school year. That's destructive, right? But there are other places that will allow you to finish even in the entire school. When I was in Rochester, for instance, if you are in school A and you move across the city, you have a right to stay in school until the end of that school's sort of span. So if you work in the 2nd grade, you can stay till 6th grade in that school, even though if you've moved. And we'll provide transportation for you no matter where you've gone to. That creates a different kind of stability that where the school environment becomes perhaps the anchor, if that's what you're thinking about. So there are ways of mitigating that, right? In creating the kinds of attachment this child needs to an adult. If you can make that happen, you go a long way in solving the problem.
And I believe that we have another online question.
Yes, this question came in via Twitter. How do you see vacant and abandoned properties affecting children's health?
That's great. Vacant and abandoned properties, I think, and how does that affect children's health? Well, we could posit multiple pathways of how that could happen. One is vacant and abandoned properties are often a nidus for criminal activity, and when there's criminal activity, then that tends to push out positive activity and create sort of a vacuum in which other sort of negative or potentially harmful things come in. So that's one way to do it in terms of creating a nidus for crime. It also, I think, is, you can imagine that it has an impact on sense of safety and sense of belonging in a place that is attractive and appealing and sustaining and promoting. And I think if, kids are perceptive from, the youngest age. They know when they're living someplace that other people don't want to live. And they know when they're living someplace where it's so bad that the people who owned it don't even want to, come back and take care of it anymore. So there's no way that doesn't get into their psyche and into their sense of self of, I'm in this place that's abandoned. What about me is also not appealing, attractive, and why am I here? I must be reflecting that sense of abandonment. So I think there's you could create, I think, multiple pathways by which that happens. I'll just say one thing about abandoned buildings and broken windows. Some public health colleagues have done some interesting correlational study. It's understood, it's definitely correlational, but looking at rates of sexually transmitted diseases, rates of unintended pregnancies, rates of a whole set of outcomes that are directly correlated to the proportion of abandoned houses and broken windows. Now, we have to assume that broken windows don't directly cause sexually transmitted diseases, but clearly there's something in that environment that that's a symbol of that then has a big impact on environment and behavior.
Great. I didn't even have to prompt. Thank you.
Michael McKnight with the Green and Healthy Homes Initiative, and with these correlations and direct and indirect associations between housing quality and health and education, how can we sort of incentivize the stakeholders within healthcare and education to take a more active role in advocating for, higher quality, affordable housing?
One of the dilemmas of this cross-sector influence, and one of the things that appealed to me so much about this area, is that the adverse impacts accrue in one sector, whereas the potential for investment or promotion, would happen in a different sector. So as I showed you that list of, terrible housing conditions, the housing authority is not going to accrue the adverse impact. That's going to be accrued by the public serving hospital, the safety net hospital, the whole host of other places that aren't connected. So part of the challenge is making relevant the costs and the impact in one sector to the other. And that really requires, I think, at the level of municipalities, the leadership of the municipal leader, be it a mayor or whatever, that says, okay, we're looking at this as a broader picture. So Medicaid agency doesn't get slammed because the housing side is providing housing with kind of wretched conditions. So I think it really requires that kind of leadership where people understand that those intersectoral effects, if we want to get after them, we have to have some sort of intersectoral accountability.
And to support that too, it's for me, it's about education. So I know so many school system leaders who don't really understand the connection, who have not seen the evidence. They know sort of tacitly what the impacts may be, but so many of us don't get access to this kind of conversation. We've not seen it. So having a convener-in-chief be the person who brings the experts together to talk about the sort of coalitional or causational sort of impacts between all changes hearts and mind. As a school system leader, if you show me exactly what this does to that, I'm going to become the biggest pain to the rest of the folks that have to be, right? But often we overwhelm and we're busy and don't really always understand what it means to be. So education is one, and second, having this convener-in-chief be the person who brings folks together, I think is also very powerful.
So we take that as a charge that our job on the evidence side is to make sure it gets to those of you who can be the big pain in the ass.
Yes.
Got it.
And you've got the right secretary who was a mayor who understands how all this comes together. I think his voice is a powerful one in being a practitioner from that sort of vantage point in pushing this dialogue to other mayors across the country.
Yes, we have time. One last question.
Sure. Katrina Durback from IPI. Thank you for the question. That perfectly leads up to mine. I was going to ask, from all of your experiences, obviously you come from different fields and perspectives, and you have your ears to the ground in ways that we don't. I was going to ask, what other either fields or organizations are you tuned into? Do you know that are equally eager on this collective front that we at PDR should be aware of? Who might we not be thinking is eager to form those partnerships to help push forward? Thank you.
We have time for another question.
Well, I have one that I'm thinking of that I actually know about because I used to be the medical director for that, and that's an organization that partners physicians and lawyers in clinical settings to ensure that people's basic needs are met and that the programs to which they're entitled and the conditions in which they live are appropriate. And not surprisingly, one of the programs that were most likely to be difficult for folks to navigate were Mass Health in this case, but Medicaid, housing, and food stamps. So those sorts of public benefits, as just as an example, but also housing conditions, interactions with landlords. We have tons of kids who have terrible asthma who go back to these really bad conditions, but because of the rental market is so tight, they're not likely to complain to their landlord because they know that, if they're out, the landlord can get someone else in, like that. So it's called the Medical Legal Partnership for Children, MLPC, and it is now expanded across the country, but they're very particularly looking at the relationship between smarter social and public policy and its broad child health impact and well-being, and they're a great partner because they have the kinds of stories that can then generate sort of policy considerations and thought. So that's one I would think of that you might be interested in.
So just to change, I guess, the answer to your question a bit. I don't really know of any bring all folks together, but there are people who are in DC or near DC who have these massive convenings of public system leaders. One is the National Child Alliance, which is based right downtown DC. The American Association of School Administrators, ASA, I believe in Alexandria. 13,000 superintendents are part of their association. The Council of Great City Schools, right near the White House, they have an office. They deal with 60 of the largest systems in this country. These three individuals can give you an audience of about 14,000 school system leaders across the country. You can bring this conversation to them, and they'll be more than happy, I think, to engage in a dialogue about what we can do together to move this conversation. So there are ways, I think, of finding those folks who are not on either side of the argument, but more central or centrist in this push, that can give you the audience for a robust dialogue around housing, education, et cetera.
We have about 2.5 minutes, so we could have time for one short question. Putting people on the spot. Okay, then I'm going to take the prerogative of just taking a minute to sort of thread two things together as more of a seed of thoughts going forward. I feel as though between the How Housing Matters conference last week and previous roundtables and us having been focused here on housing as a platform for a couple of years, that the conversation's moving forward. And so I want to emphasize two things that may be the place, Barbara, where we make some traction on making both types of programs more effective. And one is this more nuanced way of thinking about mobility and stability, right? That there are negative consequences for some form of mobility, that mobility in schools and mobility in neighborhoods may matter. And if we go back to some of the qualitative research from MTO on why some families did not move their kids from what we would objectively say are bad schools, is the parents, the mothers said, I'm moving neighborhoods, I need something stable. So the school was the stable part of the kids' lives that they kept, and that was a choice they made. And so thinking about that and mechanisms where that you could have the movement in the neighborhoods, not in the schools, and then overtimes in the schools. And the other piece here is thinking about the connection between mobility at the individual level and what it means at the aggregate level. So we've thought about that in neighborhoods, where if there's churning, what it means for neighborhoods, and thinking it now in schools, and these things come together. So I think it's amazingly complex, but that thinking about it that way, maybe we're going to make some progress on this instead of either or. And then the second thing that I find really, I know nothing about, it seems incredibly intriguing, is going over and over to the notion of buffering. We're seeing that for some of the explanation for the differential effects in our research, for why families under similar circumstances, the kids fare differently. And so it may open up an avenue for thinking about ways in which our programs can be more effective, because it's not just, oh, can we change the entire neighborhood? Oh, can we do something that helps buffer the vulnerable families that are in those neighborhoods? And in our mobility programs, are there things that we need to be doing to buffer those families when they go to these other neighborhoods that may not be so receptive at the start, et cetera? So as a tee out there for those who know more about that, maybe that's a place we'll go. And on that, I just want to thank Kevin, I think you're still here, saw you in the back. And our panelist for me was certainly the best part of my week, an intriguing conversation on critical stuff. So thank you very much. Join me in thanking them. And I am supposed to, my last thing that I always get caught up in the actual panel rather than my closing remark, which is our next briefing will be held in January 2015. That panel discussion is going to focus on the impact of disaster and resiliency, the subject of the fall issue of PD&R's quarterly publication on evidence-based policymaking. The evidence matter issue that covers today's topic will be available online next week, and then the hard copy to follow. Thank you guys for attending.